psychotherapist and Jungian analyst, member of the Society of Analytical Psychology, trainee analyst there. It's been gestating for a long, long time, but certainly one of the motives was a counsellor at a workshop that I led years and years ago on the image of woman as divine. And this counsellor came up to me at a break and said she was so relieved that the topics of woman and divinity could be talked about, because God was not allowed to be talked about. She'd taken some material from one of her patients to her supervisor about God and religion, and the supervisor had dismissed it as neurotic, irrelevant or delusional and would not talk about it. And that stayed with me all this time, the need for people to have understanding and support in reacting to this kind of material. Well, it is essentially about patients who talk about God or religion or their spiritual quest, or even the reverse of that, the emptiness of their lives, where they don't feel there is any spiritual meaning or any meaning at all. They're longing for meaning or purpose. And so the essence of the book is to try and help clinicians respond to that sort of material appropriately, so that it's helpful to their patient, rather than retreating from it because they haven't thought about it. Well, it comes a lot from my own experience, both personal experience and clinical experience, that experiences of God or the need for a spiritual purpose are very profound and very widespread. So it seems to me to be a very ordinary thing to write about. And I've been so aware of the dearth in most trainees in the United Kingdom of any attention given to this kind of material. There are one or two trainings which are excellent in this respect, and the WPF therapy is one of them, and I did my first training there before I trained as a Jungian analyst. And I've since been back there to lead the ontology seminars for several years. But there are very few trainings that take these topics as seriously as WPF therapy does. So trainees will spend years thinking about their feelings and their knowledge and their understanding of their own sexuality and other people's sexuality or their relationship to their mother. Never does the word God or spiritual search come into the seminar. It was hard work. It took a long time, and it was hard work because a lot of the subjects in it are very complex. Hazel Robinson, the series editor, and I had long discussions, particularly about the whole area of mystical experience and psychotic experience, to try and understand what this was about, what it meant to people, at what stage it became dangerous or maleficent rather than malevolent. So it was difficult. It was difficult to write, and of course the subjects are hugely numinous, sort of emotionally intense. So it was also quite an exhausting book to enter into in the depth that I wanted to try and do. So I would hope that it would become more common for trainees to talk about their own spiritual and religious life in their own therapy or analysis, which again I gather is fairly uncommon at the moment, so that they will have the ability to have counter-transference reflection on their response, rather than a knee-jerk reaction of, well, just don't believe in God then, if, you know, what a nuisance God is, what I call a sort of Richard Dawkins reaction. So yes, I hope it might change both the training and the practice of counselling and psychotherapy in its own modest way, you know, but even so. Well, it's part of an SAP monograph series, which is designed for counsellors and psychotherapists either in training or newly qualified. So it's in immediate intended audience is inexperienced clinicians. But as I say, already some people who are not connected with the therapy world at all have read part of it and found it interesting. And some people who are really quite experienced clinicians have also found it draws their attention to things which perhaps they hadn't thought about quite such a focused way before. So I think it will have I hope it will have a much wider readership than that. But say primarily it's to help people work clinically, but I think it will have a wider appeal. Well, I've already mentioned Hazel Robinson, the series editor, who has been absolutely invaluable in helping helping me to make sense of what I was trying to say. Otherwise, no, not really. I mean, I received support in a way from all my usual spiritual support resources, groups I belong to, and friends with whom I've had discussions over many years. There's a couple of groups, each of which has lasted about 10 years, where these kind of topics have been very openly talked about, and that has certainly been a great help over time. Well, in general, I would think that it's not given nearly enough prominence in our society as a whole. I think there's a huge longing, a huge spiritual longing in people, and they don't know where to find the help or the kind of access, the path that they need. Some people find it obviously through different religions, some people find it through profoundly moving aesthetic experiences, some people find it through relationships. But it feels to me that it's very sort of ad hoc and undefined, and that there's a lot of profound distress and a feeling of being ungrounded in our life, in a lot of people. I hope, sort of optimistically, that the whole balance of society would change, you know, and that people will become more religious and spiritually minded, and that maybe the churches will, of all beliefs, I don't mean just the Christian church, will become more able to communicate with people.